my name is Jennifer Huang, and today we're going to talk about animal-assisted interventions for the older adult. Here's a brief outline of my talk today. We'll start with a short case, go over types of animal-assisted interventions, touch on a very brief history, and then discuss the potential benefits and harms. So, we have a 75-year-old male who lives in a nursing home who has a past medical history of dementia, anxiety, and hypertension. He takes a lot of medications. His wife passed away a few years back, and he has one daughter who lives out of state but visits occasionally. He also recently lost a close friend. He's doing fairly well overall, but he has some periods of agitation and aggression, and the nursing staff are having a difficult time with these episodes. What more can we do for him? One thing that we might consider is animal-assisted intervention, or AAI for short. A brief definition of AAI is given here, which is the introduction of an animal into an individual's or group's immediate surroundings with therapeutic intent. So why discuss animal-assisted interventions for older adults? As we've discussed a lot this month, our future selves are taking over. Adults over 65 years old will make up almost a quarter of our population by 2060, which is depicted by the red line in this graph. So we need to think carefully about how we're going to take care of this large population of patients that often have many chronic medical problems. Medicare data shows that more than a third of the older adults in the U.S. already take 5 or more medications. AAI is a potential non-pharmacological tool that may help with a variety of medical conditions or help improve an older adult's quality of life. A little bit of history of animal use in healthcare. This is a timeline of some of the work that has been done with animals, and you can see that using animals in healthcare dates all the way back to the 9th century, where they were used for handicapped individuals. I'll also point out that Florence Nightingale noted that small pets can be good companions for the sick. Fast forward to the 1970s, and you see that animals start getting introduced more formally into hospitals and nursing homes. So there are several types of animal-assisted interventions, and we'll only focus on the first two. One is animal-assisted activities, AAA for short, which uses animals to provide motivation, education, or recreation to patients, and animal-assisted therapy, or AAT for short, in which healthcare professionals are specifically trained to use animals in their therapy sessions to help patients meet certain goals. Okay, now we'll go into the potential benefits, starting with the physical benefits. There was an interesting study done on older adults in England that compared different types of pet ownership with a whole bunch of physical biomarkers of aging. If you look at the forest plot on the right, you can see that there really is no difference in pet owners versus non-pet owners between any of these markers, which are gait speed, FEV1, chair rise, and grip strength. There are small associations between dog ownership and slower walking speed, as indicated here, and in addition, dog ownership was related to a slightly higher pulmonary function as measured by FEV1, but all of these were quite small. In the next set of biomarkers, they looked at leg raise failure and balance failure. Here, the only slight association was with cat owners being more likely to fail the leg raise test, but again, this association was very slight. They also looked at a few inflammatory markers, specifically C-reactive protein, white blood cell count, and fibrinogen. The thought is there's a 2 to 4-fold elevation in CRP in elderly compared to young, a possible association between increased white blood cell count and cardiovascular mortality, and an increase in fibrinogen might reflect a multitude of processes like subclinical degeneration of the vascular endothelium or more frequent activation of coagulation and fibrinolysis via IL-6. But in this paper, they found that pet ownership was essentially unrelated to the 3 immunological markers. Moving on to social benefits, we know that older adults are more prone to loneliness, possibly because of losing close friends or family members or withdrawing from social activities. This study examined 33 long-term care residents for 6 weeks of animal-assisted intervention 1 time or 3 times per week, and found that there was a reduced self-reported loneliness score for those in the animal treatment groups compared to no animal intervention. This graph also suggests that seeing animals 1 time a week might be sufficient, since there was no difference between the once per week group and the 3 times per week group. In a follow-up study, these authors then looked at the relative contribution of human-human bonding and human-animal bonding as mechanisms by which AAI reduced loneliness. What they found was that AAA was more effective in improving loneliness when given individually than in group situations. They hypothesized this might be due to incompatibility of group members distracting from the interactions with animals. In contrast, this study actually showed more verbal interactions among nursing home residents when animals were present compared to when they weren't. An interesting finding is that a robotic dog worked as well in reducing loneliness compared to a living dog. Another study in Japan used a robotic snail named Paro, which has 5 kinds of sensors to perceive and respond to people and its environment. The study found that Paro improved communication and interaction skills among older adults. Now we'll go to psychological benefits. Colombo et al. Found a variety of improvements in various psychosocial scores listed here after older adults had a canary for 3 months compared to a plant or neither. However, this next study showed there's no difference in the geriatric depression screen score in patients who played with a cat. Now on to the potential benefits for cardiovascular disease risk. Stacy et al. Examined older adults in a nursing home. They found a 16-point reduction in systolic blood pressure and a 5-point reduction in diastolic blood pressure in residents who had 3-hour sessions with a cat compared to those that didn't get to play with a cat. One study also showed that watching animals on videotape could produce beneficial physiological effects of lower heart rate and blood pressure, particularly during times of cognitive stress. Another study confirmed this finding and found that in older adults with hypertension, the presence of a dog was associated with lower blood pressure in response to the stress of public speaking. These studies and others led the American Heart Association to provide these recommendations regarding pets and cardiovascular disease risk, although this is not specific for older adults. Pet ownership, particularly dog ownership, may be reasonable for reduction in CVD risk, but pet adoption or purchase should not be done for the primary purpose of reducing CVD risk. Now, looking at dementia. A few studies have shown that animals help with increasing social interactions and decreasing agitation among older adults with dementia. Churchill et al. Showed that long-term care residents exhibited significantly less agitation during the difficult sundowning period when interacting with dogs. Walsh found that these benefits were short-lived, however, reverting to baseline within 30 minutes of dog and handler departure. It's thought that the benefit in dementia patients may be a result of the increased reliance by animals on body language, so they might be able to communicate better with individuals with dementia. Now, thinking back to our case of the gentleman with some agitated outbursts, animal interventions might be a potentially useful non-pharmacological tool to help calm some of this behavior. It could also potentially help increase social interactions between him and fellow residents. These next studies looked at markers of stress and found no difference in heart rate, blood pressure, skin temperature, or salivary chromogranin A, or CGA. CGA is a neuroendocrine marker that is thought to be secreted in response to mental stress as part of the sympathetic response pathway. The major advantage of using salivary CGA is that its sampling is non-invasive and can be performed in non-stressful conditions. It's also secreted immediately after stress, whereas cortisol level takes around 30 minutes to peak. Finally, this study showed that having a fish aquarium instead of a scenic ocean picture was associated with increased nutritional intake and weight in individuals with Alzheimer's. So how do we think that animal therapy helps? It's been suggested that animals may induce an immediate physiologically calming state of relaxation by attracting and holding our attention, or they may act as a form of social support that helps to reduce stress. Here are a few of the potential limitations or harms of animal-assisted interventions. There's a risk of falls and fractures. CDC data from 2001 to 2006 shows that more than 86,000 falls per year are due to dogs and cats. Most commonly, this occurs to women tripping over pets or falling while bending over to feed them. In addition, pet care is expensive and time-consuming. As we all know, healthcare for older adults is expensive, so adding on the cost of providing for these animals might not be feasible for many people. Older adults might also be less able to interact appropriately with animals. In one study, they found that nursing home residents were placing cats in the garbage or toilet, and some nearly ran over the cat's tail with their wheelchairs. There's the theoretical risk of human infection and trauma, but this is not well documented. And finally, there's potential psychological harm from losing one's pets. One harm to animals that occurred in some of these studies is abuse. Many of the interactions were well-intentioned, but things like inappropriate overfeeding happened, where every person that saw the dog fed it a little treat, which is okay, but when you add up all those little treats from different people, you have a dog that gets overfed. So, in summary, animal-assisted interventions may provide physical, social, or psychological benefits to older adults. They may accomplish this by inducing a calming state of relaxation or acting as a form of stress-reducing social support. Many studies have been performed to analyze the usefulness of AAI with mixed results and often marginal effects, which suggests that more research is needed on this topic. There are potential harms to AAI, as we discussed, and as such, AAI may not be for everyone, including those who are disinterested in or fearful about interacting with animals, or those who have medical conditions that would worsen with animal exposure, like an allergy or open wounds. Thanks for listening.